Hello and welcome to the Anaphylaxis Awareness Training for School Staff. This presentation has been written and recorded by the Children and Young People's Nursing Team in Lincolnshire. Objectives for this presentation: to have an understanding of what anaphylaxis is, to be aware of all the possible signs and symptoms of anaphylaxis, to understand what to do in an emergency and how to support a child who is having an anaphylaxis reaction, to demonstrate how to use an adrenaline auto-injector, understand correct storage and record keeping responsibilities for the school. Anaphylaxis is a serious whole-body allergic reaction. It can occur when someone is exposed to something they are allergic to, known as an allergen. Symptoms usually occur within minutes of exposure to the allergen. However, they may occur up to 2 to 3 hours later. Allergic reactions are caused by the sudden release of chemicals, including histamine, from cells in the body. The release is triggered by the reaction between the immune system and the allergen it has been exposed to. The mechanism is so sensitive that sometimes even tiny amounts of an allergen can cause this allergic reaction. Anaphylaxis is a life-threatening condition that requires immediate treatment. So, common allergens. Although many things can cause anaphylaxis in certain individuals, there are common allergens, food being the most common. In the UK, food businesses must provide information about any of the 14 major known food allergens when they are used as ingredients in the food and drink that they provide. Those 14 major allergens are dairy, eggs, fish, shellfish, which are mollusks or crustaceans, peanuts, tree nuts such as Brazil nuts, soya, celery, cereals containing gluten, mustard, sesame seeds, sulfites or sulfur dioxide, often found in dried fruit, and lupin, which is derived from the lupin plant. Other common allergens are insect venoms, and this is usually in the form of bee or wasp stings in the UK. Certain drugs, in particular antibiotics, aspirins and vaccines. And although children are vaccinated in schools, it is important to remember the nurses doing these clinics are all trained to recognise and treat anaphylaxis and carry emergency adrenaline at all school sessions. Other allergens may be latex or hair dyes, and sometimes the cause is not known, and when this is the case, it is called idiopathic anaphylaxis. Signs and symptoms. Most healthcare professionals consider an allergic reaction to be anaphylaxis when it involves difficulty in breathing or affects the heart rhythm or blood pressure. In extreme cases, there could be a dramatic fall in blood pressure. The person may become weak and floppy and may have a sense of impending doom. Signs of anaphylaxis usually happen very quickly and can appear within minutes of contact with an allergen. There are a wide range of symptoms which may occur but may not be the same pattern or range of symptoms for each individual. However, any of the ABC symptoms that we'll look at on the next slide may lead to collapse and unconsciousness, and on very rare occasions could be fatal. Any one or more of the following symptoms may be present in anaphylaxis, and these symptoms are often referred to as the ABC. A is for airway, which includes swelling of the throat, the tongue or the upper airways, and can cause difficulty in swallowing. The first sign may be a sudden cough, changes to the voice such as croaky or hoarse. B is for breathing. Difficulty breathing may be obvious as the person may be gasping for breath. They may also have sudden onset of wheezing or noisy breathing and a persistent cough. C is for circulation or consciousness. Internally, the person may have a dramatic fall in their blood pressure, and this may show as dizziness, feeling faint, sudden sleepiness, confusion, and in a child often shows because they become pale and floppy. This can then lead to loss of consciousness or collapse. Other symptoms of anaphylaxis can include a widespread flushing of the skin, an itchy raised red rash called urticaria, also known as nettle rash or hives, and this can appear anywhere on the body. Angioedema is a swelling of the skin and mucous membranes, and while it can occur anywhere on the body, it is often seen on lips, tongues and eyes. There can be gastrointestinal disturbances such as nausea, vomiting, abdominal pains and diarrhea. It can cause a cough, an itchy or tight feeling in the throat and a tight chest. And often the first sign someone has is a sudden feeling of impending doom. The photos on this slide show examples of angioedema. Number 1 and 2, examples of the eye swelling and of lip swelling. And then photo 3 is an example of urticaria, the skin rash, also sometimes known as hives and nettle rash. If you suspect anaphylaxis, you need to commence emergency treatment. If any severe symptoms are present, then lie the child down, unless this makes breathing difficult or worse, and then sit them down. Get help, but do not leave a child alone. Don't make them stand up or walk. Anaphylaxis causes a low blood pressure. Standing or walking can make blood pressure drop even more rapidly, which reduces blood flow to the heart, which can potentially lead to collapse and cardiac arrest. Laying the child flat will increase blood pressure and help blood flow back to the heart. When you call for help, ensure someone gets the anaphylaxis emergency kit in school. Call 999 and say anaphylaxis. Administer adrenaline auto-injector into the outer thigh. You do not have to remove clothing. Rub the injection site once it has been administered. Make a note of the time and the place used for the injector and place the used injector back in its plastic box. This will need to go with the ambulance crew. If there has been no improvement in symptoms or the symptoms become worse, after 5 to 10 minutes, administer the second auto-injector in the opposite leg. The child must always go to hospital regardless of recovery. Contact the parents after the 999 call. If a child has diagnosed anaphylaxis, then they should have an adrenaline auto-injector prescribed by a medical professional. They should always have 2 adrenaline auto-injectors with them. And if they are at school, they should also have 2 separate adrenaline auto-injectors to be kept at school. The brand names of these adrenaline auto-injectors currently used in the UK are Emerade, EpiPen and Jext. They all contain the same adrenaline. They are all preloaded and the dosage is prescribed according to age. Please click on the individual videos to watch the training videos of how to administer Emerade, EpiPen and Jext adrenaline auto-injectors. The EpiPen video does refer to a person administering it to themselves, but it is the same process if you are administering it too. They all talk about doses. School staff do not need to worry about this, as a medical professional will have prescribed the correct dose. Allergies are immune responses to allergens, and they cause mild to moderate symptoms, while anaphylaxis is a severe life-threatening allergic reaction that requires immediate medical attention. Mild to moderate symptoms of allergies can include an itchy runny nose, itchy watery eyes, sneezing, coughing and shortness of breath, a raised red itchy rash known as urticaria or hives, and this can be anywhere on the body, a tingly or itchy feeling in the mouth, throat or even ears, stomach pain, vomiting or diarrhea. Children who have anaphylaxis can also have allergies that do not cause anaphylaxis. And if there are no ABC symptoms, that is airway, breathing, circulation, the reaction is likely to be less serious and may not need emergency treatment. But watch carefully in case the ABC symptoms do develop. As discussed earlier, anaphylaxis symptoms can sometimes take 2 to 3 hours to develop after contact with an allergen. So to be prepared and to help you and those around you, it is important you know what to do in case of an emergency. A child with anaphylaxis may have mild allergic symptoms that can be treated with medication. Antihistamines are probably the best known type of allergy medication and can be taken at the first sign of allergic symptoms. This should all be discussed with family and school to ensure it is part of an individual care plan for that child. If antihistamines are to be administered in school as part of a care plan, the family need to provide this medication for schools. Once given, as agreed in the care plan, the child will need to be monitored carefully for any increase in symptoms which may then require emergency treatment. It is important to follow guidance on supporting children with medical conditions in school. And school responsibilities include ensuring all staff are aware of the children with anaphylaxis at that school and their known allergens. And this should include all catering staff, which is particularly important for food allergens, but it also ensures supply staff are also aware. Keep a care plan for each child with anaphylaxis and ensure this is updated annually or if there are any changes. And ensure staff have access to anaphylaxis awareness training. Supporting pupils with medical conditions in school is guidance produced by the Department of Education to help manage all health conditions in schools. There is a section on anaphylaxis and risk management, and this is important for schools when creating care plans for pupils with anaphylaxis. The guidance webpage has sample healthcare plans and medical consent forms, and the link is available in the references at the end of this presentation. Where possible, it is advised that avoidance to all known allergens is followed. Avoidance includes being aware of the allergen, if this is possible, and ensure all staff, including catering staff, are aware of the child and their allergens. Discourage food sharing and educate children about the reasons for this. Clean surfaces and wash hands after eating. Children could unwittingly pass allergens from their hands onto surfaces, and some children have such sensitivity to their allergens this could trigger anaphylaxis. Make sure emergency medicines, the adrenaline auto-injectors, are in a box. They shouldn't be locked away and should be close to the child. Therefore, for PE lessons and school trips, ensure the child's anaphylaxis kit is with them. And for secondary school pupils, it may be safer for the child to carry it with them in the school bag at all times, and for staff to be aware of this. Get school staff to read the care plan regularly to ensure they remain up to date. Families should notify the school of any allergies and support the production of a healthcare plan for their individual child. They should provide written medical instructions from the GP or medical professional. They should provide emergency adrenaline auto-injectors that are in date and replace them when they are out of date. They should also educate their child about their allergens and their emergency management plan. Spare adrenaline auto-injectors for schools. Legislation came into force in 2017 which allows schools to purchase adrenaline auto-injectors without a prescription for use in schools. This is in case of an emergency and if the pupil's own adrenaline auto-injectors are not available. This may be because their own are broken or out of date. Under the same legislation, schools are also able to purchase salbutamol asthma reliever inhalers. And you can visit pens in schools for more information about how and where to purchase. The legislation changes in 2017 on the use of adrenaline auto-injectors in school allow schools to purchase their own adrenaline auto-injectors. However, schools are not required to do this. It's a discretionary change enabling schools to do this if they wish. And the Department of Health document is very clear. The adrenaline auto-injectors are used only with children where they have a known risk of anaphylaxis and they have been prescribed their own adrenaline auto-injector. All pupils known to be at risk must also have medical authorization and a written parental consent has been provided. Children with food allergies are not always prescribed adrenaline auto-injectors but may still be at risk of anaphylaxis. These children can be given the spare adrenaline auto-injectors in an emergency as long as the following criteria are met. The school has a care plan confirming that the child is at risk of anaphylaxis. A healthcare professional has authorised the use of a spare adrenaline auto-injector in an emergency for that child, and the child's parent or guardian has provided consent for the spare adrenaline auto-injector to be administered. The spare adrenaline auto-injectors must not be used where a child has no diagnosis and no medical authorisation, but they may be showing signs of anaphylaxis. In these cases, call 999 and say it is possible anaphylaxis, then follow their instructions. You can inform the 999 staff that the school has their own adrenaline auto-injectors and then follow their advice. It is important that all pupils with diagnosed anaphylaxis have an individual care plan. This should be created with the help of the family for use in school. The British Society for Allergy and Clinical Immunology has a variety of care plan templates that are available on their website and are specific to the type of adrenaline auto-injectors pupils have. The link is at the end of this presentation. Adrenaline auto-injectors should be kept in an easily accessible place that is known to all school staff and where they can be accessed by anyone in the case of an emergency. A lunchbox or other similar sturdy box would be an ideal place to keep them. Each box must be labelled with the child's name and that it is their emergency anaphylaxis box. Inside should be a copy of the care plan and 2 adrenaline auto-injectors. It may also be useful to stick a printed copy of how to administer their adrenaline auto-injector to the inside of the lid. The box should be regularly reviewed, and when the adrenaline auto-injectors are nearing their expiry date, the family informed so they can replace them. They should also be kept out of direct sunlight. Worried? It's okay to be worried, but just remember you can't harm a child by administering adrenaline, but you can save a life by administering adrenaline. If you are ever in doubt if it's anaphylaxis, always administer the adrenaline auto-injector. They are all pre-filled injections with the correct dose for that child, so you cannot overdose. In summary, anaphylaxis is manageable, and with sound precautionary measures and support from staff, school life should be able to continue as normal for all concerned. But just remember, if you are in any doubt, administer the adrenaline auto-injector. Obviously, this is a voiceover, so we can't answer questions, but please, if you do have any questions, direct them to our email at bs_healthservices@lincolnshire.gov.uk, and we will do our best to answer any questions or queries you may have.